Hi, my name is Kim, and I've been working here with Dr. Ong for 24 years. I started out as a patient with my parents before Dr. Ong purchased this practice, and then I started interning here and decided that this was a profession that I wanted to stay in, and Dr. Ong was kind enough to train me the proper way. Dr. Ong is wonderful. She's always on top of all the high-tech gadgets, and she's very innovative. She's been a great mentor as well as a wonderful friend. Our newest acquisition is the CEREC machine, which fabricates crowns in a few hours in the dental chair. We don't have to send crowns out to be fabricated in the lab, which is a plus for many patients who can't take the time off more than one day to have a crown made. We've come a long way with the fabrication of crowns and implant crowns, because now patients come in, we take a scan using our computer, we fabricate it here in our lab, and we cement it within about 2 hours the process takes. Before, we have to take an impression with goopy things that would make people gag and people would complain about it, send it out to the lab. They would be in a temporary for 2 weeks, sometimes longer, and come back, try it in, make sure everything fit, and they would be on their way. Sometimes there were complications. With the CEREC machine, if there are any complications, they're corrected that same day. This is the CEREC machine here. This is what they call the acquisition unit. And it's very nice. Dr. Ong preps the tooth. She prepares it in the mouth, of course. And we use this wand here to take an image of the tooth in the mouth. We would just place it in like this. The camera makes a nice click, click sound, and then it's fabricated here. Or the image shows up here, actually. Then Dr. Ong would design the margin, make sure everything is good. If she sees any type of a flaw or a discrepancy in the preparation, then we just retake it again. We fix the discrepancy in the mouth, retake another image, and we're good to go. From this acquisition machine, then the computer sends the data over to the milling machine. We take a little solid block such as this, solid block, we place it into the machine, and then we press start. The machine fabricates the crown using water jets and 2 burrs only. If you notice, it's purple, so the tooth does come out in a purple, what we call the purple phase. It's easier to adjust. It's softer in that state. We can adjust the bite, adjust the contacts, and then we bake it in the oven. From the milling unit, after the crown has been sized in the mouth and everything is ready to be finished, then we place it on this little pedestal, place it in the oven, and we bake it for about 25 minutes. It bakes in about 20 minutes. We let it cool for about 5 minutes because it's very hot. The oven gets up to 780 degrees. It changes the crown from the purple phase to the desired shape that the patient chose. And that's how we do the CEREC crown. After it comes out of the oven, we take it back to the patient, we prepare it for cementation, and that's it. Then we're good to go.